Hello and welcome to Ayurveda Mentor. In this video, I will tell you about one blood test that's very important in metabolic conditions like diabetes, obesity, high blood levels of cholesterol and triglycerides. At the same time, it is becoming more and more significant in autoimmune disorders and other conditions that involve chronic inflammation. It is an accepted theory right now that stress on the mental side and insulin resistance on the physical side are two of the very strong triggering factors for autoimmune disorders. That's why when you are adopting anti-inflammatory diet in your life, then you will be able to measure the impact of that diet and lifestyle on your body through this simple test HbA1C. HbA1C measures the level of glycohemoglobin, glycated hemoglobin or glycosylated hemoglobin inside the blood. You do not have to worry about these complex medical terms. I will be telling you in a very simple way. First, we see what is hemoglobin. It is a pigment inside red blood cells and it consists of iron and protein. What is the function of hemoglobin? It carries oxygen from lungs to different tissues and then carries back carbon dioxide from tissues to lungs. So you see hemoglobin is inside the red blood cells. That's why it's carrying out its work when it is circulating throughout the network of blood vessels. When the level of blood glucose is rising, it is having a tendency to bind with, to associate with hemoglobin. So when the level of blood glucose is rising more and more, it is having more and more tendency to bind with hemoglobin. Now you can understand the medical terms. We have two words here, glucose and hemoglobin. When glucose is binding with hemoglobin, this is what is measured by the test HbA1C. So glucose plus hemoglobin, you have three words, glycohemoglobin or glycated hemoglobin or glycosylated hemoglobin. Simply you can call it HbA1C or simply A1C. The average lifespan of a red blood cell is 3 months. It's very important when you want to understand the significance of HbA1C. HbA1C gives you the idea about what have been your average blood glucose level over a period of 3 months. So you see the lifespan of a red blood cell is 3 months. So HbA1C is giving you idea about what have been your average blood glucose level over a period of 3 months. You have to understand this point very carefully. When I say 3 months, you consider that there is a baseball player. He is playing every day. On some day he is scoring very high, on some day low, or on some day just getting out at 0. So when you have the period of 3 months, you can sum up the record of every day and make an average of it. In similar way, if you are jogging or walking every day, on some days you are going for 5 miles, on some days only 2 miles, on some days none at all. So you sum it up and what is the average of the 90 days? It is your HbA1C that's telling you that this is the average blood glucose value for past 3 months. Another point to clarify here is that HbA1C doesn't give you the reading of blood glucose level at any given point of time. There are three popular readings. One is fasting. When you do not eat anything overnight, you go in the morning for blood test, you have the fasting blood sugar. Another is PP or postprandial. When you have breakfast and you go after 2 hours for the blood test, that is PP blood sugar. The third one is random. So when you are going anytime for the blood test, This is the random blood sugar. These three levels are providing you the readings of a particular time. If you look at this chart, you will find that this is the way our blood sugar is going up and down throughout the day. Whenever we are eating some food that is providing lot of simple carbs like sugars or complex carbs that are broken down finally inside the digestive system into simple sugars, then our blood sugar spikes, it goes up. After some time, then it comes down. So this is happening throughout the day whenever we are eating something. So if you sum up all the readings of 3 months, then you arrive at HbA1C, that is average of 3 months of blood sugar level. Each of the value of HbA1C corresponds with an average blood glucose value. You will be able to understand it by looking at this chart. When the A1C reading is 4, average blood sugar level is 68. A1C is 5, average blood sugar level is 97. A1C 6 corresponds with 126 of blood glucose level. A1C 7 with 152. A1C 8 with 183. When A1C is rising, the average blood glucose value is also rising a lot. A1C 9 corresponds with 212, 10 with 240, 11 with 269, 12 with 298, 13 with 326. Look at this chart. This is giving you an association between A1C reading and diabetic condition. If A1C reading is below 5.7, you are a normal healthy person. Congratulations. If the reading is between 5.7 to 6.4, you are into pre-diabetic category. And this is the best time for you to take care of your health, of your metabolic condition through diet, lifestyle and herbs. If your A1C reading is 6.5 and above, then you are a diabetic person. You are clinically diagnosed with diabetes. You have to understand that diabetes and hypertension are the two disorders. When they are not managed properly, they can cause lot of inflammation inside blood vessels, inside nervous system, inside all the organs. That's why it's very important to manage these problems. I want to deviate here from the diabetic and metabolic health, and this is very important deviation for autoimmune disorders. When someone is having autoimmune disorders, there is ongoing inflammation, and these disorders are chronic, progressive and degenerative in nature. That's why you see lot of inflammation in these conditions, and there is a growing evidence right now from medical researches that there is association with triggering of autoimmune disorders or triggering of autoimmune disorders born inflammation inside the body and insulin resistance. I will go into more detail about this topic in another video. Insulin resistance is considered right now one of the very important factor for all the chronic disorders, not only for diabetes and metabolic conditions, but all the inflammatory conditions, all the autoimmune disorders, and there is growing evidence toward it. And when you adopt anti-inflammatory diet and lifestyle in the right way, then you start to get great benefit in these conditions. So you see here insulin resistance, and it is associated with autoimmunity, or you can say triggering of the autoimmune condition. I am giving here some simple suggestion how often you should have blood test for HbA1C. Always follow the advice of your medical practitioner or healthcare provider. If you have obesity, you are overweight, having metabolic syndrome, other problems with hyperlipidemia, high blood levels of cholesterol or triglycerides, having any sort of autoimmune disorders or any other chronic inflammation, you should have HbA1 test at least once a year. Do not consider your age. Even if you are 30 years, 35 years, you should have it once a year. If you are in the diabetic category or pre-diabetic category or having hypertension with high blood cholesterol and triglycerides or compromised renal function, have HbA1c test every 3 months. It's very, very important. If you are having some autoimmune disorders or chronic inflammatory condition and HbA1c is in pre-diabetic category, at that time you should have it once every 3 to 6 months. It's very important here for you to consider when you are adopting anti-inflammatory diet and anti-inflammatory lifestyle, you have to have this test every 3 or 6 months. It can tell you how your efforts are going on the way of reducing insulin resistance. I have taken the help of some of the references here. These are thanks for taking the time to watch this video. I will appreciate having your feedback about this topic. I'm an Ayurveda doctor. We are providing Ayurvedic treatment, natural treatment of autoimmune disorders and chronic conditions. We are also providing Ayurveda and Yoga based health and wellness training programs and coaching. So finally, thanks again. Adopt Ayurveda and Yoga in your daily life. Have better health and greater happiness now and always. Thank you. Namaste.